Hey, Dr. Rory Cernik here with the Hearing Assessment Center. 1 out of 6 baby boomers suffer from hearing loss. We know there are 48 million Americans living every day with hearing loss and more than 40 million Americans every day living with dementia. And these are important statistics to keep in mind for what I'm about to say. The average person is going to wait 7 years. 7 years between when they first realize they're not hearing as well as they once were until they have a baseline hearing test done. And here's the challenge with that. There are consequences of untreated hearing loss. And number one, with hearing loss, the brain lacks stimulation. And just like any other muscle or tissue or tendon in the body, if there's not stimulation, an atrophy event is going to occur. On top of it, with hearing loss, oftentimes our brain is left to fill in the gaps. It tries to put the pieces of the hearing puzzle together, but in doing so, our physical fatigue is going to increase, but also our concentration is going to decline. We know that hearing loss untreated over time is going to accelerate our risk of developing dementia. It's also obviously going to change our quality of life and increase our fall risk as well. So we need to change the dialogue in knowing that as soon as someone has one symptom of hearing loss, their family says something, there's ringing in the ear, they feel like they're not hearing as well as they once were, or their gut is just telling them to have a hearing test done, we have to do that as quickly as possible. So if someone has a diagnosed hearing loss, we can do what we need to do, quickly identify it, treat it, improve their quality of life, and offset their risk of further cognitive atrophy and decline. If you or a loved one is suffering from hearing loss, get in touch with your local audiologist. If you live near one of our offices, we're happy to take care of you. But if you have any questions, hearingassessment.com, find us on Facebook. Again, Dr. Rory Cernik. Talk to you next time.